Okay, so my name's Mandy Clark. I was born in the hospital in Harlow, and I was diagnosed 18 months ago. Well, yeah, 18 months, June 2018. I was working a 13-hour shift in the hospital and wasn't feeling too well. Went home, didn't think nothing of it. Next night, was in a lot of pain. Come up to A&E, done a scan on me. They kind of didn't have to tell me. You can tell by their faces that they knew there was something wrong. On the Tuesday I had a scan and I got told I had terminal cancer. Basically right from the start they told me the whole process of what was going to happen within the next sort of like 3 or 4 weeks. Obviously I found it quite scary because I've got children and like my husband obviously. Scared, it's a bit daunting because even though I got explained everything, at some point you sort of listen but you don't hear. You don't really take it in as much as what you think you should. So yeah, you have your cry and everything, but it's after a while you just think to yourself that you think, okay, so you've been told what you've got, so you've got to really deal with it and basically get on with it and see how it goes. A bit scared because obviously you don't know what's going to happen, but you just, in me personally, it was just a case of right, okay, you've had your moment with your family, so you just got to get on and see what happens really, and that's you just got to face it.
And she's had a few little hiccups, but overall you've done really well. She's tolerated her treatment really well. So Mandy will have had what we call a pre-assessment before starting her chemotherapy. So this is about an hour or so with one of the sisters to just discuss the chemotherapy, what to expect, the process involved and what side effects they may or may not experience. So that's a huge amount of information given to them in a very short space of time, and it's very overwhelming. So when the patient then comes in for their first cycle of chemotherapy, it's pretty standard to give most of that information almost again, but in a different way. You want to introduce them to the unit so they understand their surroundings. Environment is a really big deal here because it's so daunting and there's so much anticipation leading up to that first chemotherapy for any patient and their relatives. It's so important that they feel comfortable and settled into where they are.
They're just great. They're just really great. You know, they'll converse with you. They'll talk to you about whatever you want to talk about as well. Like, you know, they'll talk about your family, anything. You know, they're really. It's quite a happy place, really, because as well patients get to know each other as well, because you come in like, on a regular basis, and people get to know each other, and it's not scary a place to come. It's quite a nice place to sort of like sit and put your feet up for 3 or 4 hours.
The community feel of the unit as well, that we have everybody sitting together, I think some people are really surprised by that, but actually it makes it more comforting.
I wouldn't like to be sitting on my own.
No, it's nice to sit around people going through a similar experience, and you know, on the whole our patients here are lovely, and once you've had a few cycles you know what it's like to be coming in for your first time. And you know, Mandy's great at saying to somebody, oh, you know, don't worry, like I've had that, and you know, the nurses know what they're doing, because some people are just terrified, and it's really hard to give reassurance from us because obviously it's our job, but the other patients know how it feels.
As well, especially here, if something does happen to you like at home and you get scared about it and you think, sometimes I don't know, but some people might not want to talk about things at home that are not pleasant, but they always encourage you to talk about it. Like next time you come, they always say, like, how have you been, had any problems? So they always encourage you to talk about the bad side of things as well, not just the happy side of things, so that you're not scared to tell somebody that if you are having a bad day. Sometimes when you go to like hospitals, sometimes you feel like the nurses are just doing it because they're nurses, but here you can feel that they mean it. You know, that because as they get to know you, they are, you know, they genuinely do want to know how you are doing. It's not just it's part of their job. They do actually want to know whether you've had a good weekend, or how's the treatment been this week, or have you been sick. you can feel that they want to know that. It's not just something that they're doing because it's part of their job. I know it sounds really strange, but I like coming here. It's nice. It's a nice, like, even if you're feeling a bit tired or a bit, you're not feeling too well, when you come here, it's like, oh, yeah, if they cheer you up. Oh, hello Mandy, how you doing? Right, and everything like that. And so yeah, it does make you feel instantly, oh, okay, yeah, so maybe, maybe I shouldn't feel so bad. When people think about cancer, they think it can be sad and doom and gloom. But when you come to a place like this and you do get to know people, it can be happy, and it is a happy place, even though that sounds a bit strange, but it is true.
The team here are phenomenal. I'm so proud to work with a team of fabulous nurses. Our manager here, Sarah, is excellent. She works really hard to make sure that the patients are safe and that us as staff are safe. Our HCAs are brilliant. Without them, the continuity just wouldn't exist from clinic, because the patients all get seen in clinic by the consultants between their chemotherapies. There's so much communication involved in making sure that when the patient comes here for the chemotherapy, it's right. And that's hugely important. And our admin staff, our receptionists, they're complex bookers, and it is complex.
So as soon as you walk through the doors, the receptionists, like I said, I've been coming here for nearly 18 months, so they all know me, and you can giggle with them as well, and they all say hello, how are you doing as well. So as soon as you walk through the doors, you feel at ease. And then you walk in here and you say hello to the reception staff as well, and the healthcare assistants. And it's just the whole place is a warm, happy place to be. If you're going to be treated for cancer, then it's a nice place to come.